Question 1. A registered nurse is preparing to administer a new medication to a patient who has been admitted under the Mental Health Act. The patient is refusing the medication, despite it being prescribed by the doctor and deemed essential for their mental well-being by the multidisciplinary team. The patient has fluctuating capacity. What is the nurse's most appropriate initial action? A. Administer the medication, as it is prescribed and deemed essential. B. Inform the patient that refusal is not an option due to the Mental Health Act. C. Document the refusal and postpone administration until the patient is more cooperative. D. Reassess the patient's capacity to make a decision, explain the medication again, and involve the multidisciplinary team to review the treatment plan if capacity is not present. Answer: D. Reassess the patient's capacity to make a decision, explain the medication again, and involve the multidisciplinary team to review the treatment plan if capacity is not present. This question tests the complex intersection of the Mental Health Act, patient capacity, and informed consent. The keywords refusing medication, Mental Health Act, and fluctuating capacity highlight the need for careful consideration of the patient's rights and legal frameworks. Nurses must always prioritize a patient's autonomy, so the immediate step is to reassess their capacity to ensure they understand the decision they are making. If capacity is absent, the multidisciplinary team, in accordance with the Mental Health Act and potentially the Mental Capacity Act, must determine the best interests of the patient regarding treatment, ensuring all actions are least restrictive. For instance, before administering a psychotropic medication against a patient's wishes, a nurse would ensure formal capacity assessments have been conducted and reviewed. Always remember to uphold patient rights, even when legal frameworks permit treatment against a patient's immediate wishes. Question 2. A nurse is conducting a ward round and finds a patient distressed, stating, "I don't know who you are, or where I am." The patient's observations are stable, but they have a history of dementia. Which immediate action is most appropriate for the nurse? A. Reassure the patient that they are safe and reorient them gently, then check their care plan for a baseline cognitive assessment. B. Assume the patient is acutely unwell and initiate a full set of vital signs and a neurological assessment. C. Document the confusion and inform the next shift, as it is likely due to their dementia. D. Ask a family member to come in immediately to help orient the patient. Answer: A. Reassure the patient that they are safe and reorient them gently, then check their care plan for a baseline cognitive assessment. This question challenges nurses to differentiate between acute deterioration and chronic conditions like dementia, while prioritizing person-centered care. The keywords distressed, don't know who you are, and history of dementia point to a potential episode of confusion, but with stable observations, an acute physical cause is less immediately apparent. The most appropriate initial response is to calm and reorient the patient, as sudden distress can exacerbate confusion, and then review their baseline cognitive status in the care plan to compare. While physical assessment is important, gentle reassurance and understanding the patient's usual state takes precedence given the stable observations. For example, sitting calmly beside the patient and explaining, "You are in St. Mary's Hospital, and I am Sarah, your nurse," can often reduce immediate distress. Always remember to treat the person first, using their care plan as a guide for their usual cognitive function before assuming an acute decline. Question 3. A newly qualified nurse identifies an unsafe staffing level on their ward, which they believe compromises patient safety. They have raised this verbally with the ward manager multiple times, but no action has been taken. What is the nurse's next most appropriate course of action according to the NMC Code? A. Continue to work and hope the situation improves, as challenging management can be difficult for a new nurse. B. Refuse to work until the staffing levels are improved, as this is a patient safety issue. C. Document their concerns, escalate through the organizational hierarchy, e.g., to a senior nurse or director of nursing, and if unresolved, consider external channels such as the NMC. D. Discuss the issue with colleagues and collectively sign a petition to management. Answer C. Document their concerns, escalate through the organizational hierarchy, e.g., to a senior nurse or director of nursing, and if unresolved, consider external channels such as the NMC. This question tests a nurse's professional accountability and duty to raise concerns, particularly in a challenging and persistent situation. The keywords unsafe staffing level, compromises patient safety, and raised verbally multiple times, no action indicate a serious and unresolved concern that requires escalation. The NMC Code mandates that nurses must act to protect people and raise concerns following their organization's whistleblowing policies, escalating through appropriate internal channels first, and then to external bodies like the NMC if necessary. For instance, the nurse should create a written record of their concerns, detailing dates and times of previous discussions, before approaching a more senior manager. Always remember that patient safety is paramount, and your professional duty extends to escalating concerns through formal channels when internal resolution fails. Question 4. A patient with advanced metastatic cancer expresses a wish to discontinue all active treatment and pursue only palliative care, focusing on comfort at home. Their family, however, insists that the doctors continue aggressive chemotherapy. The patient has full mental capacity. What is the nurse's primary ethical responsibility in this situation? A. Support the family's wishes, as they are often best placed to make decisions for their loved one. B. Persuade the patient to continue treatment, highlighting the family's desire for them to live longer. C. Advocate for the patient's autonomous decision, ensuring their wishes are clearly communicated and respected by the healthcare team. D. Document the disagreement and allow the family and medical team to reach a consensus. Answer C. Advocate for the patient's autonomous decision, ensuring their wishes are clearly communicated and respected by the healthcare team. This question presents a complex ethical dilemma involving patient autonomy versus family wishes, a common challenge in end-of-life care. The crucial phrases are patient expresses a wish to discontinue all active treatment and patient has full mental capacity. When a patient possesses full mental capacity, their autonomous decision-making takes precedence, even if it conflicts with family desires or the healthcare team's initial recommendations. The nurse's role is to advocate for the patient, ensuring their informed wishes are understood, respected, and implemented in the care plan. For example, a nurse would facilitate a meeting between the patient, family, and medical team to clearly articulate the patient's choices and help the family understand the principles of autonomy and consent. Always remember that a patient with capacity has the ultimate right to choose their own care, and your role is to support that choice. Question 5. A patient on your ward unexpectedly develops sudden, severe shortness of breath and becomes visibly cyanosed. They also have an irregular, weak pulse. What is the first immediate action the nurse should take? A. Initiate basic life support and call for immediate medical assistance. B. Administer oxygen via a non-rebreather mask. C. Check the patient's most recent medication chart for respiratory depressants. D. Elevate the head of the bed to ease breathing. Answer A. Initiate basic life support and call for immediate medical assistance. This question tests immediate recognition and response to a critical, life-threatening situation. The keywords sudden, severe shortness of breath, visibly cyanosed, and irregular, weak pulse indicate a patient in extremis, potentially in cardiorespiratory arrest. In such a rapidly deteriorating scenario, the immediate priority is to initiate basic life support measures while simultaneously calling for urgent medical assistance, following an ABCDE approach. For example, if the patient is unresponsive and not breathing normally, chest compressions and rescue breaths are started immediately. Always remember that in a life-threatening emergency, rapid assessment and initiation of basic life support are paramount, before other interventions. Question 6. A nurse is caring for an elderly patient who is nonverbal and has a learning disability. The patient appears restless and is repeatedly pulling at their ear. The family reports this is unusual behavior. What is the nurse's most appropriate initial action? A. Administer a prescribed as needed sedative to calm the patient. B. Assume the patient is bored and provide them with a distraction. C. Conduct a thorough physical assessment, focusing on the ear and signs of pain or discomfort. D. Document the behavior and observe for 24 hours to see if it resolves. Answer: C. Conduct a thorough physical assessment, focusing on the ear and signs of pain or discomfort. This question challenges nurses to interpret nonverbal cues and advocate for vulnerable patients who cannot verbally express their needs. The keywords nonverbal, learning disability, restless, repeatedly pulling at their ear, and unusual behavior strongly suggest the patient is experiencing pain or discomfort that they cannot communicate. The most appropriate initial action is a thorough physical assessment to identify any underlying cause, as this behavior is often a sign of physical distress in nonverbal individuals. For instance, pulling at an ear could indicate an ear infection, so inspecting the ear canal and checking for tenderness would be crucial. Always remember that for nonverbal patients, changes in behavior are often their only way of communicating a problem, requiring prompt investigation. Question 7. A patient requires a complex dressing change, which involves specialist aseptic technique. The ward is exceptionally busy, and the nurse feels rushed. What is the nurse's primary professional obligation in this situation? A. Complete the dressing change as quickly as possible to manage workload. B. Delegate the task to a less experienced colleague who has some basic aseptic training. C. Ensure the procedure is performed safely and correctly, even if it means delaying other non-urgent tasks or seeking assistance. D. Document that the ward was busy and therefore full aseptic technique could not be strictly adhered to. Answer: C. Ensure the procedure is performed safely and correctly, even if it means delaying other non-urgent tasks or seeking assistance. This question tests a nurse's ability to prioritize patient safety and professional standards amidst workload pressures. The keywords complex dressing change, specialist aseptic technique, and exceptionally busy highlight a high-risk task where adherence to procedure is critical, despite environmental challenges. The NMC Code mandates that nurses must practice effectively and safely, and this includes maintaining high standards of care, even when under pressure. If rushing compromises safety, the nurse must either take the necessary time, delegate appropriately, only if the delegate is fully competent, or seek help to ensure the procedure is performed without risk. For example, if you realize you are too rushed to perform the dressing change correctly, you should inform the ward manager and ask for assistance or a reprioritization of tasks. Always remember that patient safety and professional standards are non-negotiable, even in busy clinical environments. Question 8. During a routine home visit, a community mental health nurse observes that a patient with schizophrenia, who typically manages their medication well, has an overflowing bin, significant dirt, and uneaten food in their living space. The patient states they are fine. What is the nurse's most appropriate initial intervention? A. Document the observations and schedule another visit for the following week. B. Immediately contact the patient's family or next of kin to report the deterioration. C. Conduct a comprehensive assessment of the patient's self-care, medication adherence, and mental state, exploring potential reasons for the changes. D. Offer to clean the patient's living space and dispose of the rubbish. Answer: C. Conduct a comprehensive assessment of the patient's self-care, medication adherence, and mental state, exploring potential reasons for the changes. This question challenges nurses to go beyond superficial observations and conduct a thorough assessment in the face of concerning signs. The keywords schizophrenia, overflowing bin, significant dirt, uneaten food, and patient states they are fine indicate a potential deterioration in mental health or self-care, despite the patient's denial. The most appropriate initial action is to perform a comprehensive assessment to understand the underlying causes of these changes, which could include medication non-adherence, worsening symptoms, or other contributing factors. For instance, the nurse might gently ask about their daily routine, recent thoughts, and if they've been taking their medication as prescribed, rather than immediately jumping to conclusions or calling family. Always remember that a thorough assessment helps identify the root cause of changes in a patient's condition, guiding appropriate interventions. Question 9. A nurse is caring for a patient from a minority ethnic background who is receiving end-of-life care. The patient's family requests specific religious rituals that conflict with standard hospital policy regarding visitors and movement of the deceased. What is the nurse's most appropriate action? A. Explain that hospital policy must be strictly followed for all patients. B. Allow the family to perform the rituals as long as they don't cause any disruption. C. Discuss the requests with the ward manager and palliative care team to find a way to accommodate them while maintaining safety and dignity. D. Suggest that the family perform these rituals after the patient has been discharged home. Answer: C. Discuss the requests with the ward manager and palliative care team to find a way to accommodate them while maintaining safety and dignity. This question tests cultural competence and respectful, person-centered care in a sensitive end-of-life context. The keywords minority ethnic background, end-of-life care, religious rituals, and conflict with standard hospital policy highlight the challenge of balancing cultural needs with institutional rules. The most appropriate action is to actively seek to understand and accommodate the family's needs, collaborating with the healthcare team to find flexible solutions that respect cultural practices while upholding safety and dignity. For example, it might involve adjusting visiting hours or arranging a private space for rituals, perhaps with a representative from the family's faith community present. Always remember to advocate for culturally sensitive care, ensuring that a patient's spiritual and cultural needs are met, especially at end of life. Question 10. A patient's prescription specifies furosemide 40 mg once daily PO, per oral. On checking the medication trolley, the nurse finds only furosemide 20 mg tablets. What should the nurse do? A. Administer 2 20 mg tablets to achieve the prescribed dose. B. Administer the 20 mg tablet and document the discrepancy, informing the doctor later. C. Withhold the medication and wait for the pharmacy to deliver the correct strength. D. Contact the prescriber immediately to clarify the prescription and request a revised order or alternative. Answer: D. Contact the prescriber immediately to clarify the prescription and request a revised order or alternative. This question tests critical thinking and safe medication practice in the face of a discrepancy. The keywords furosemide 40 mg once daily PO and only furosemide 20 mg tablets indicate a mismatch between the prescription and available stock. Administering 2 20 mg tablets might seem logical, but it represents a deviation from the original order and could be a calculation error or a change that the doctor has not formally prescribed. The safest and most professional action is always to clarify any discrepancies with the prescriber to ensure patient safety and adherence to the right drug, right dose principle. For example, calling the doctor to confirm if 2 20 mg tablets are acceptable or if a different course of action is required, is essential. Always remember, if in doubt, always check with the prescriber before administering medication. Question 11. A nurse discovers that a colleague has been routinely signing for medications on the patient's chart before they are actually administered, citing busyness as the reason. This is against hospital policy. What is the nurse's primary ethical and professional responsibility? A. Discuss the issue directly with the colleague and advise them to stop the practice. B. Report the colleague to the ward manager and complete an incident report, as this is a serious breach of professional standards. C. Ignore it, as long as no patient harm has occurred. D. Offer to help the colleague with their workload so they do not feel the need to pre-sign. Answer: B. Report the colleague to the ward manager and complete an incident report, as this is a serious breach of professional standards. This question presents a challenging ethical scenario involving a colleague's professional misconduct. The keywords routinely signing for medications, before they are actually administered, and against hospital policy identify a serious breach of medication safety protocols and professional integrity. Pre-signing medications creates a false record and poses a significant risk to patient safety, making it a serious professional misconduct. The nurse's primary responsibility is to report this unsafe practice through formal channels to protect patients, as per the NMC Code's duty to raise concerns. For instance, documenting the observed practice and informing the ward manager ensures that the incident is officially recorded and addressed appropriately. Always remember that patient safety and maintaining accurate records are paramount, and you have a duty to report practices that compromise these standards. Question 12. A patient with advanced chronic obstructive pulmonary disease, COPD, is experiencing increasing breathlessness and anxiety. The patient asks, "Am I going to die?" What is the most appropriate and sensitive response from the nurse? A. Don't worry, you're in the hospital and we're doing everything we can. B. Perhaps you should talk to your family about these feelings. C. What makes you ask that question right now? Tell me more about how you're feeling. D. We all die someday, but let's focus on getting your breathing better. Answer: C. What makes you ask that question right now? Tell me more about how you're feeling. This question tests advanced communication skills, particularly in responding to existential fears in palliative care. The keywords advanced COPD, increasing breathlessness and anxiety, and the direct question, "Am I going to die?" demand an empathetic, open-ended response. The most appropriate action is to invite further conversation by exploring the patient's feelings and concerns, rather than shutting down the conversation with false reassurance or deflection. This approach allows the nurse to understand the underlying anxieties and provide appropriate emotional support and information. For example, opening the conversation allows the patient to express fears about pain, being alone, or unfinished business, which the nurse can then address. Always remember that responding to difficult questions with openness and active listening builds trust and provides true comfort. Question 13. A patient's family brings in a traditional herbal remedy that they believe will help their critically ill relative, asking the nurse to administer it. The remedy is not prescribed and the nurse is unfamiliar with its contents. What is the nurse's professional responsibility? A. Administer the remedy, as it is culturally sensitive and important to the family. B. Politely decline and explain that only prescribed medications can be administered by nurses. C. Administer the remedy but document it as a patient's own medication without further action. D. Encourage the family to administer it themselves, as long as it doesn't interfere with medical treatment. Answer: B. Politely decline and explain that only prescribed medications can be administered by nurses. This question explores the challenge of respecting cultural practices while adhering to medication safety and professional boundaries. The keywords traditional herbal remedy, not prescribed, and unfamiliar with its contents highlight the potential risks and the nurse's professional limits. Nurses can only administer prescribed medications that they are competent in and aware of the ingredients and potential interactions to ensure patient safety. While cultural sensitivity is important, it cannot override the duty to administer safe and evidence-based care. For example, the nurse could explain that while they appreciate the family's wishes, they cannot administer unprescribed substances due to safety regulations. Always remember that patient safety and professional standards must guide your actions, even when navigating cultural differences. Question 14. A nurse suspects that a patient, who frequently requests strong pain relief, may be developing a dependence. The patient consistently rates their pain as 10 out of 10 despite increasing doses of analgesia and exhibits drug-seeking behavior. What is the nurse's most appropriate initial action? A. Confront the patient directly about suspected drug dependence. B. Continue to administer prescribed analgesia as per the chart, as pain is subjective. C. Document observations comprehensively, discuss concerns with the multidisciplinary team, and collaborate on a revised pain management plan. D. Withhold the next dose of pain relief to test if the patient truly needs it. Answer: C. Document observations comprehensively, discuss concerns with the multidisciplinary team, and collaborate on a revised pain management plan. This question addresses the complex issue of pain management, potential drug dependence, and professional judgment. The keywords frequently request strong pain relief, consistently rates their pain as 10 out of 10 despite increasing doses, and drug-seeking behavior indicate a need for careful assessment and a multidisciplinary approach. The most appropriate initial action is to gather comprehensive objective data through documentation, then discuss these concerns with the multidisciplinary team to collaboratively reevaluate the patient's pain, explore underlying causes, and develop a safe and effective pain management strategy. For instance, the team might consider a pain specialist review or non-pharmacological interventions. Always remember to manage pain holistically and safely, involving the team when concerns arise about dependence or ineffective treatment. Question 15. A nurse is conducting a medication review for an elderly patient who takes multiple medications. The patient mentions they sometimes forget to take their evening dose. What is the most appropriate nursing intervention? A. Simply remind the patient about the importance of adherence during the visit. B. Document the non-adherence and inform the doctor for potential medication changes. C. Explore the reasons for forgetting, assess their medication regimen, and collaborate with the patient to implement practical strategies to improve adherence. D. Assume the patient's family is not helping enough and suggest they take over medication management. Answer: C. Explore the reasons for forgetting, assess their medication regimen, and collaborate with the patient to implement practical strategies to improve adherence. This question tests a nurse's ability to address medication non-adherence proactively and in a person-centered way. The keywords elderly patient, multiple medications, and sometimes forget to take their evening dose point to a common issue that requires more than a simple reminder. The most appropriate intervention is to delve deeper into the specific challenges the patient faces, e.g., complexity of regimen, cognitive issues, social support, and then work with them to find practical, tailored solutions. For example, suggesting a weekly pill organizer, setting phone alarms, or simplifying the regimen in consultation with the doctor can significantly improve adherence. Always remember to empower patients by helping them overcome barriers to medication adherence, rather than just identifying the problem. Question 16. A nurse is asked by a patient's spouse if they can review the patient's medical notes, stating, "We share everything." The patient is awake, alert, and capable of making their own decisions but is currently asleep. What is the nurse's most appropriate action? A. Allow the spouse to review the notes, assuming implied consent given their relationship. B. Politely decline, explaining that patient consent is required, and offer to facilitate this when the patient wakes. C. Provide a summary of the patient's condition verbally to the spouse, but do not show the notes. D. Ask the spouse if they have power of attorney for health and welfare. Answer B. Politely decline, explaining that patient consent is required, and offer to facilitate this when the patient wakes. This question tests the strict principle of patient confidentiality and consent, even with close family members. The keywords patient is awake, alert, and capable of making their own decisions and currently asleep are critical. Even if spouses share everything, confidentiality dictates that a patient's medical records cannot be shared with anyone, including family, without the explicit consent of the competent patient. The nurse must uphold confidentiality and respectfully explain this boundary, offering to involve the patient in granting consent once they are able. For example, if the patient has not given prior consent for their spouse to view records, the nurse must wait for the patient to wake and then ask them directly if they wish their spouse to see the notes. Always remember that a competent patient's right to confidentiality is absolute, regardless of their relationships. Question 17. A nurse observes a colleague using an outdated and incorrect technique for a sterile procedure. The colleague appears confident and has been qualified for many years. What is the nurse's immediate professional responsibility? A. Trust the colleague's experience and assume their technique is acceptable. B. Avoid confronting the colleague to prevent conflict. C. Gently intervene and offer to assist or provide a reminder of the correct procedure, then reflect on why the outdated practice is occurring. D. Immediately report the colleague to the ward manager for unsafe practice. Answer C. Gently intervene and offer to assist or provide a reminder of the correct procedure, then reflect on why the outdated practice is occurring. This question presents a challenging scenario about addressing suboptimal practice in a colleague, balancing professional respect with patient safety. The keywords outdated and incorrect technique and sterile procedure indicate a potential for patient harm, but the colleague's confidence and many years suggest they might be unaware of updated guidelines. The most appropriate immediate action is a non-confrontational intervention to correct the practice, offering support or a reminder of the current standard, then to reflect on the situation to understand and address the root cause of the outdated practice, which is often a learning need. For example, you might say, "Would you mind if I just quickly showed you the updated trust guidance on this sterile dressing?" Always remember that upholding professional standards means addressing incorrect practice directly but respectfully, fostering a culture of continuous learning. Question 18. A patient on a general surgical ward suddenly becomes very agitated and confused, attempting to climb out of bed, despite a recent fall risk assessment categorizing them as low risk. Their vital signs are within normal limits. What is the nurse's most appropriate initial action? A. Recategorize the patient as high fall risk and apply full restraints to prevent injury. B. Administer an as-needed sedative to manage the agitation. C. Assess for underlying causes of the acute confusion, such as infection, pain, or medication side effects, and implement appropriate safety measures. D. Document the agitation and confusion, and wait for the doctor to review the patient on their next ward round. Answer C. Assess for underlying causes of the acute confusion, such as infection, pain, or medication side effects, and implement appropriate safety measures. This question tests the nurse's ability to recognize and investigate acute changes in a patient's mental state, known as delirium. The keywords suddenly becomes very agitated and confused, attempting to climb out of bed, and low fall risk, implying a change from baseline, strongly suggest an acute medical issue, even with stable vital signs. The most appropriate action is a thorough assessment for underlying, reversible causes of the confusion, while simultaneously implementing immediate safety measures, such as increased supervision or bed alarms. For instance, the nurse should check for signs of a urinary tract infection, assess for pain, or review new medications that might be causing the confusion. Always remember that acute confusion is a medical emergency, and a thorough assessment is crucial to identify and treat the cause. Question 19. A nurse is reviewing an elderly patient's care plan which states NPO after midnight for a morning procedure. The patient, who has mild cognitive impairment, asks for a cup of tea at 6 a.m. What is the nurse's most appropriate action? A. Give the patient the tea to avoid distress, as the procedure is still hours away. B. Firmly remind the patient that they are NPO and offer no explanation. C. Gently explain why they cannot have tea, NPO instructions, recheck the time of the procedure, and then assess if the patient fully understands, reiterating as needed. D. Inform the doctor that the patient is refusing to comply with NPO instructions. Answer: C. Gently explain why they cannot have tea, NPO instructions, recheck the time of the procedure, and then assess if the patient fully understands, reiterating as needed. This question tests the nurse's ability to communicate complex instructions to a vulnerable patient while ensuring patient safety for a procedure. The keywords NPO after midnight, mild cognitive impairment, and asks for a cup of tea at 6 a.m. highlight a potential risk of noncompliance due to cognitive issues. The most appropriate action is to patiently explain the NPO instructions, ensure the patient understands by checking comprehension, and reaffirm the importance for their safety during the procedure. For example, explaining that not having food or drink protects their lungs during anesthesia can help the patient understand the importance. Always remember that effective communication with cognitively impaired patients requires patience, clear language, and repeated explanation to ensure understanding and compliance. Question 20. A patient expresses significant anxiety about receiving an intramuscular injection, stating they have a severe phobia of needles. They become visibly distressed at the sight of the needle. What is the nurse's most appropriate initial action? A. Proceed with the injection quickly to get it over with, as the patient needs the medication. B. Tell the patient to calm down and that it will only hurt for a second. C. Acknowledge the patient's anxiety, offer distraction techniques, or discuss if another route of administration is feasible with the prescriber. D. Delay the injection indefinitely until the patient feels less anxious. Answer: C. Acknowledge the patient's anxiety, offer distraction techniques, or discuss if another route of administration is feasible with the prescriber. This question challenges nurses to provide compassionate, person-centered care while managing a patient's genuine fears related to a procedure. The keywords significant anxiety, severe phobia of needles, and visibly distressed indicate a need for empathetic and practical intervention. The most appropriate action is to validate their feelings, offer strategies to reduce anxiety, like deep breathing or distraction, and explore alternatives with the prescriber if possible, always prioritizing patient comfort and safety. For instance, you could engage them in conversation about a favorite hobby while preparing the injection, or ask the doctor if an oral form of the medication is equally effective. Always remember to approach patient fears with empathy and seek to minimize distress whenever possible. Question 21. A nurse on night shift notices that a patient's fluid balance chart shows a significantly lower urine output than expected over the last 8 hours, despite adequate fluid intake. The patient's vital signs are stable. What is the nurse's most appropriate initial action? A. Assume the patient has been holding their urine and will void later. B. Document the low output and continue to monitor for another 8 hours. C. Perform a comprehensive assessment of the patient's hydration status, palpate the bladder, and consider a bladder scan or catheter review. D. Administer a prescribed diuretic to increase urine output. Answer: C. Perform a comprehensive assessment of the patient's hydration status, palpate the bladder, and consider a bladder scan or catheter review. This question tests the nurse's ability to identify and investigate potential signs of acute kidney injury or urinary retention, even with stable vital signs. The keywords significantly lower urine output than expected and adequate fluid intake indicate a potential problem with urinary elimination or kidney function. The most appropriate action is a focused assessment to determine the cause, which could include dehydration, urinary retention, if applicable, or acute kidney injury, guiding appropriate intervention. For example, a nurse should check for a distended bladder by palpation and then consider using a portable bladder scanner to measure residual volume. Always remember that a change in urine output is a critical sign that requires prompt and thorough investigation to prevent serious complications. Question 22. A patient, who is a Jehovah's Witness, refuses a blood transfusion essential for a life-saving surgery due to their religious beliefs. The surgical team is ready to proceed. What is the nurse's role in this situation? A. Persuade the patient to accept the transfusion by explaining the risks of refusal. B. Inform the surgical team that the patient's refusal is based on religious beliefs and cannot be overridden. C. Ensure the patient's informed refusal is clearly documented, and that alternative, bloodless management options have been explored and offered, if medically appropriate. D. Seek an immediate court order to proceed with the transfusion in the patient's best interest. Answer: C. Ensure the patient's informed refusal is clearly documented, and that alternative, bloodless management options have been explored and offered, if medically appropriate. This question addresses a highly sensitive ethical and legal dilemma regarding a competent patient's right to refuse life-sustaining treatment based on religious beliefs. The keywords Jehovah's Witness, refuses a blood transfusion essential for life-saving surgery, and the implied mental capacity are central. The nurse's role is to ensure the patient's autonomous, informed decision is thoroughly documented, respecting their right to choose, and to confirm that all clinically appropriate alternatives have been discussed and considered. For example, the nurse would ensure the patient understands the full implications of their decision, that bloodless surgical techniques have been discussed, and that a formal refusal of treatment form is signed. Always remember that a competent patient's right to refuse treatment, even life-saving treatment, is a fundamental aspect of autonomy that healthcare professionals must respect. Question 23. During a multidisciplinary team, MDT, meeting, a junior doctor proposes a treatment plan for a patient that the experienced nurse believes is inappropriate and potentially harmful, based on their extensive clinical observations and understanding of the patient's history. What is the nurse's professional responsibility? A. Remain silent, as the doctor is the prescriber and their decision should be respected. B. Express their concerns politely in the meeting, providing evidence from their observations and the patient's history, advocating for a review of the plan. C. Discuss the concerns privately with the doctor after the meeting to avoid embarrassment. D. Document disagreement in the patient's notes without discussing it with the team. Answer: B. Express their concerns politely in the meeting, providing evidence from their observations and the patient's history, advocating for a review of the plan. This question challenges a nurse to exercise professional assertiveness and advocate for patient safety within a multidisciplinary team. The keywords experienced nurse, believes is inappropriate and potentially harmful, and extensive clinical observations highlight the nurse's responsibility to contribute to patient care decisions. The most appropriate action is to voice concerns constructively within the MDT meeting, using evidence from their observations to advocate for the patient and ensure the proposed plan is thoroughly reviewed. For example, a nurse might say, "Based on my observations of Mrs. Smith's reduced oral intake and previous adverse reaction to that medication, I am concerned about this proposed dose. Could we consider an alternative?" Always remember that you have a professional duty to challenge decisions that you believe are not in a patient's best interest, using your expertise to advocate for safe care. Question 24. A patient has a do not attempt cardiopulmonary resuscitation (DNACPR) order clearly documented in their care plan. The patient's family, unaware of this order, panics when the patient collapses and demands immediate resuscitation from the nurse. What is the nurse's most appropriate immediate action? A. Immediately begin resuscitation, as the family's wishes override the DNACPR order in an emergency. B. Calmly explain to the family about the DNACPR order and the implications for the patient. C. Quickly retrieve the DNACPR form to show the family while simultaneously calling for medical assistance. D. Call for medical assistance and, while waiting, try to find a doctor to explain the DNACPR to the family. Answer: B. Calmly explain to the family about the DNACPR order and the implications for the patient. This question presents a highly stressful ethical and practical dilemma regarding end-of-life decisions and family communication. The keywords DNACPR order clearly documented and family, unaware of this order, demands immediate resuscitation are critical. The nurse's immediate priority is to respectfully and calmly communicate the existing DNACPR order to the family, explaining its implications in the context of the patient's collapse. This delicate conversation ensures that the patient's documented wishes are upheld, while offering compassionate support to the distressed family. For example, the nurse might say, "I understand this is incredibly distressing, but patient's name has a do not resuscitate order in place, meaning we will focus on comfort care at this time." Always remember that upholding a patient's end-of-life wishes is paramount, requiring sensitive and clear communication with families. Question 25. A patient who recently underwent abdominal surgery reports increasing pain, but also expresses a fear of becoming addicted to opioid analgesia and refuses the prescribed dose. What is the nurse's most appropriate action? A. Document the refusal and only offer non-opioid pain relief, as the patient's wishes are paramount. B. Educate the patient about effective pain management, the difference between dependence and addiction, and explore their specific fears about opioids, while reoffering the prescribed analgesia. C. Inform the doctor that the patient is being non-compliant with their pain management. D. Administer a placebo to the patient to manage their pain without increasing opioid exposure. Answer: B. Educate the patient about effective pain management, the difference between dependence and addiction, and explore their specific fears about opioids, while reoffering the prescribed analgesia. This question explores the challenge of managing acute pain while addressing patient fears and misconceptions about medication. The keywords increasing pain, fear of becoming addicted to opioid analgesia, and refuses the prescribed dose highlight a conflict between the need for pain relief and patient anxiety. The most appropriate action is to educate the patient, addressing their specific concerns about addiction versus dependence, a common misconception in acute pain management, and explaining the importance of adequate pain control for recovery. For example, a nurse would explain that short-term, prescribed opioid use for acute post-surgical pain is rarely associated with long-term addiction. Always remember that patient education and addressing their fears are crucial to ensuring effective and safe pain management.